All right. Really looking forward to this last session. Those of us on the program committee who are locked up in our ivory tower of academia know how important it is to get some practitioners in here to help put some context onto all this information you've heard about BRD today. And so what we've got for the final session is 4 excellent practitioners, 2 from the world of beef cattle and 2 from dairy cattle. Each of them is going to speak for about 10 minutes on their experience with BRD, and then we'll have them up at the table for a question and answer session. So since it's late in the day, hopefully 4 10-minute presentations will be easy to kind of hold your attention. And then we'll have a short break, and we'll have the poster session and cocktail hour begin. So our first speaker, Dr. Kynan Sturgess, is from Hereford Veterinary Clinic in Texas. Dr. Sturgess is a 1991 graduate of Oklahoma State University. He worked as a staff veterinarian for a corporate cattle feeding organization for 3 years after graduation, and then spent 2 years in mixed practice, having primarily feedlot consultation and contract clinical research responsibilities. The next 6 years were spent in the pharmaceutical and biological manufacturing industry as a technical services veterinarian. In 2001, he re-entered feedlot consultation practice and formed, along with others, Kynan Veterinary Consultants. In addition to feedlot consultation practice, he became the Director of Research for Veterinary Research Associates in 2002. He currently is engaged in providing feedlot consultation services, auction market services, conducting clinical research in beef cattle for pharmaceutical and biological manufacturers, and managing an animal health database for feed yard clients of his own and 8 other consultants. Dr. Sturgess has spent 2 terms on the ABC Board of Directors, served as the liaison member of the Beef Quality Assurance Task Force, chaired the Corporate Sponsors Committee, and served on several other committees. So thank you very much, Dr. Sturgess, for being with us, and look forward to hearing from you.
How many of you all thought of why are you here? Got any answers? Why'd you come? Learn something. Well, usually the response is, I needed CE so the state board wouldn't take my license away. But you got 1,000 different opportunities to do CE without travel. I mean, you can do them online, you can do whatever. So obviously this topic of this whole meeting is pretty important, and which is obvious from the standpoint of it's probably one of the most well-attended meetings I've been to in a while. One of the reasons that I'm here is that I had an interesting conversation here about a month ago. Actually, I had a student with me, went to a feedlot, and I'd sat down at the computer and was pulling some reports out of the machine, and the feedlot manager comes in and proceeds to give me what I'd consider a polite gluteal trimming, which was a good experience for the student to actually see something like that and not, be a cussing match or anything, which it can be sometimes. But he was asking about, or he was telling me, wasn't asking, that we black guys need to do a better job this year of keeping these calves alive, and what are we going to do different, and on and on and on. One of the first things I sat and thought to myself was, does he think I'm holding out on him? But as you think about it, you finally realize that what he's really trying to tell you is that the impact of respiratory disease is ever more important to him than it ever has been. So, doesn't mean that we necessarily had a worse fall last year than we did the one before, but the economics of the situation are significantly different. She mentioned my background. I put this up mainly to admit my handicaps that some of you probably believe in, from my OSU background, Okies and all that stuff. But I've been in practice for 23 years, did all that stuff. I've had the chance to do a lot of studies over the years, and I've added to that mountain of data that Mike talked about earlier that hadn't been published. but it's not my data, so I can't really do anything about that. I actually started doing a lot more clinical mixed practice work, though, about 4 years ago, and just because I was getting tired of telling people this is what you need to do, and they didn't ever listen, and we kept going through the same circles over and over, and so I had the opportunity to do this and fire some of the clients I really didn't like anyway, and gained about 1,000 more that I'm not sure if I like yet or not. My perspective, though, has since I began practice has been centered around working with you can call it high risk, ultra high risk, whatever you want to call it. They're what I call sick, dying calves. We buy calves at virtually every one of our customers' yards that come out of sale barns, mostly out of Texas, Oklahoma, but some degree out of the Southeast. We got our heads handed to us so many times with some of these real Southeastern calves that we get pretty choosy about some of those now. Because, and part of that's just the distance that they're having to travel, but the last 10 years, I would say that we've probably seen more heifers than we have cutting bulls and steers. They just seem to work better for a lot of the clients that we worked with. However, that's changing dramatically right now. If you don't believe that the heifer retention is going on, I would tell you that it's definitely going on. They're much harder to acquire today than they were even 6 months ago. Just to give you an idea of the impact of what is going on nowadays with the values of animals. I mean, 400-pound calf is worth $1,100. If you take that $1,100 divided by 125, which is how many heads in that load that came in, that's $8.80 a head on that load that dead just cost you, just one. And just to give you a reference, I mean, our metaphylaxis costs are somewhere in that $9 to $17 range. That's including the feedlot markup and everything. So all of those figures are debatable. I mean, it depends on if you can get them bought for that. But it's relatively close. I mean, it's huge. It's doubled what the impact. I mean, the respiratory disease impact is. Give you some stuff to basically back up what Dr. Engler showed us earlier. Is this is our population database for respiratory disease. This actually goes back to 1995, so it's roughly 20 years of data, updated through, actually this would be June data here of this year. This is looking at it on a monthly basis, so it's very similar to some of the other veterinarians in the group here that monitor this, but just looking at the number of respiratory deaths divided by the average inventory of that feed yard for the month. And this is looking at quite a few feed yards. In the earlier days, there were probably only, that probably represents 18 feed yards, whereas now towards the end you're looking more about 50 feed yards. So, but they're all 15,000 head capacity or larger. I mean, up to 100,000, and they're all over the board. But you can see that there's a definite trend that's rising. It's not a terribly high trend, but we've seen lots of technologies come along, but yet we haven't really seen much change. And I'll support Dee's assertions about nutritionists that we actually see a higher increase or higher trend line with digestive deads over that same time period. It's an interesting phenomenon going on right now is that we're actually seeing a bit of a decline over the last 6 months. Not across all yards, but I mean, there's obviously variability in that, but it's been interesting to see that change. I've actively asked nutritionists, are y'all reducing, the volatility of your rations intentionally because you're trying to reduce the impacts of death loss just from the values of the animals. Really, nobody has given me none of them have said, yes, that's what we're doing. But I've also seen increased levels of roughage going into some of these rations. Not terribly big differences, but certainly there. Of course, our level of digestive death loss still isn't nearly to the same level of the respiratory over that same time period. So definitely has, in my opinion, has increased slightly in my practice career. Part of what I see that's actually contributed to this is, particularly with my clients where we handle so many high-risk calves, is that there's fewer and fewer larger herds that are marketing calves through those means anymore, and so we just continue to get the bottom end of things. The animals that aren't well cared for, they're not castrated, they're not weaned, they're just. Daughter goes to school and they need some tuition money, so they sell a few calves, and that's pretty typical. I do think too that at least based on my observations, we have seen an increase in microbial resistance, and so I think it's contributing. From a diagnostic standpoint, to me, I see some interesting tools out there. We've tried some of these things. Mixed levels of success, but at the end of the day, from a pure production standpoint and dealing with large feed yards and the labor that they will provide for us to implement our programs, we still rely on visual observation, which isn't good enough. I mean, there's got to be a better way of doing it. It's probably going to cost us a lot of money, but it's probably going to be worth it at the end. We don't find very many good people out there anymore. We have to take what we can get and try our best to train them as best we can. So I don't see that changing. Few comments about prevention. In my opinion, IBR vaccines do a pretty good job of preventing IBR, but probably don't do that much to prevent BRD. So you can take that for what it is. If it was that good of a preventive, then we would have seen a lot of difference with better vaccines that have come along. BVD, it's hard to say. We still culture it out of lungs. It's probably the most frequently cultured in my practice from the lungs. Whether the vaccine's doing much good, I don't know. It's interesting to hear the dairy folks talk about BRSV because I never find it. Not in my practice area. I don't ever see it. We run virus isolation, histopath, culture and sensitivity on every lung sample that we send in. Don't expect it to pick it up on virus isolation, but I would expect to pick it up on histopathology and see some kind of lesions described by the pathologist to say, hey, this is a possibility. 23 years, I've never seen it. Probably see it up north, other places, different types of environments. In a high-risk sale barn calf out of the southeast, South Texas, I don't see it. So we don't vaccinate for it. May be wrong, but that's what we do. As far as the bacterins, toxoids, all those things out there, so far I haven't found any of these products to really provide a clinically significant improvement. The only control measure that we've found that has a definite impact, and it's not as good as it has been in the past, has been metaphylaxis. And I wish that weren't the case. I'd just soon not have to give them a $20 or $25 shot to keep them alive. But in our hands, it's definitely shown to be more effective than not doing it. So sometimes we feel like we're hanging on by a thread. In case you don't recognize that guy, that's our former fearless leader, Dr. Muchagama. That's how they ride pins in South Texas.
All right, let's thank Dr. Sturgess. All Our next speaker is Dr. Jessica Laurin. Dr. Laurin attended Kansas State University, where she obtained both a Bachelor of Science in Animal Science and a degree in veterinary medicine. She practiced in southwestern Kansas for a few years, then moved back to her home area, where she established the Animal Health Center of Marion County, Incorporated, in 1996. Dr. Laurin purchased Tri-County Veterinary Center in Harrington, Kansas, and added it to the practice in 1997. She's been active in many professional organizations. She's a past board member of the Kansas Veterinary Medical Association, the current vice president of the Academy of Veterinary Consultants, and she serves on the Rural Veterinary Sustainability Committee for the American Association of Bovine Practitioners. Dr. Laurin has made presentations to several veterinary schools on behalf of the Academy of Rural Veterinarians. Thank you very much for doing that. Dr. Laurin has also spoken at veterinary continuing education conferences, including twice presenting at the Western Veterinary Conference in Las Vegas. Thanks, Dr. Laurin.
Wow, thanks for having me. I guess I'm president-elect. I'm excited because to be program chair this year. And I'm going to brag about this because I got a call from Ed Johnson in Idaho. And we have an Eddie Johnson that comes into our practice with dogs. And so my receptionist, when she said, Ed Johnson's on the phone for you, she was kind of confused. I knew exactly who it was. And he was telling me about how we had an opportunity to have Baxter Black on the program Friday. So you better be here Friday afternoon. It's going to be a lot of fun. I really am a mixed animal practitioner. I really would rather be outside right now. And after about 2 days of doing this, I will really want to be outside. So being here for 4 days is going to be a little bit hard for me. That's why I stand in the back. So I'm used to jeans. I'm used to boots. I'm adult onset ADHD. I can't focus on anything for a long period of time without deciding it's time to focus on something else. So it was kind of interesting to get asked to come in here and talk about my clinical impressions because I'm a mixed animal practitioner. I live on the edge of the Flint Hills in Kansas. Beautiful country, you know. We got trees. We got grass. At least we had rain this year, so now we have grass. We had to say that because putting some expensive products in some cow herds this spring, getting ready to go out to summer grass, and it wouldn't rain, and it wouldn't rain, and it wouldn't rain. And Memorial Weekend, I'm thinking, shoot, they're going to start bringing them in here in about 2 weeks because we didn't have any pond water. Thank God it started to rain. So now we are finally getting some grass. That's about 2 or 3 miles away from my house. I took that picture one day, posted on Facebook, and Chuck McClendon, his grandpa, Bud McClendon, had managed cattle in the Flint Hills for years upon years. And grandson Chuck's taken that over, and he manages cattle. And he looked at that gate, and he said, oh, I know exactly where that gate's at. So that's on the east side of the practice. On the west side of my practice, kind of more where I grew up, is farm country, dryland, upland farm country, mixed anything. We grow about anything, just depends on the weather, the time of the year, the markets. Our wheat did not grow good this year. We had winter wheat freeze out, which we don't really ever see that in our country. When the guys started cutting wheat this year, they were happy when it was 45 bushels an acre cutting wheat at the beginning because towards the end it was 8 to 10 bushels an acre. I was at a place last week, and it took them 36 days to combine all their wheat. When they got started, they got hurried up and got everything they could because once the rains hit, and it was weedy and it was thin because of the freeze out. And, you know, it was real dry, so they were worried first we're going to make wheat. Well, wheat likes dry weather, so we made wheat, but we made lots and lots and lots of weeds, too. And Roundup started getting used, and when you spray Roundup on a field, you have to wait about, 7 to 10 days before you can harvest. Pretty soon, we got rain again, weeds started coming up, and they started coming up, and these guys are so frustrated. And it was hard planting corn in our country this year. It was kind of like early March or late March, kind of get in April. It kept not wanting to rain. It kept not wanting to rain. Thank God for short season corn. Guys are saying 3 to 4 ears per stalk. We look amazing this year. After we started getting the rains in June, it just kept raining and kept raining. It's amazing talking to everyone about how all over the country there's going to be corn this year. So I was saying probably better bet that come August, corn's going to be, what do you think, 345? Some people said less than 3. So cattle will be moving because of that. Yes, BRD makes an impact. In my world, I don't deal with the big feed yards. I deal with producers in my area that own a lot of stuff, a lot of land, a lot of equipment. They put up their own crops. They put it into their own cattle. So they own the cattle that they have. So we're talking, in confinement when we get started, anywhere from 1,000 to 5,000 head in confinement. Depends on their management practice, whether they stay in, they go out, it just depends. But yes, BRD is a stress. It's definitely an economic stress, and it's definitely an emotional stress. Because again, they own those cattle. They're right there with them every single day. So yes, it does make an impact. And you know, we're all talking about this. I heard Dee in the morning, and you were just talking about this too. N equals $1,000. Last year I really started saying that. N doesn't equal a feed yard pen in my world. N equals $1,000. And this year it's way more than that. So you can see the price slides. AMS report last week. Kansas, you were buying 572 pounds, $14.64. If I went over one state, it was $20 back. If I went over to Kentucky, I'm $100 back. And if I went over to Carolinas, you're in about $200 back. I've got a few producers that all buy cattle from the same buyer out of Virginia's. They really like this guy. Virginia's, Carolinas, I was figuring probably about the same shipment cost out, so I asked one of my guys. They said about $40 a head to ship them this way. If we figure 6 to 8% shrink, probably add another $100 to that. So I still got about, $60 to work with. So if I can keep my cost of BRD, metaphylaxis, loss on gain, mortality, $40 or less, then they're still breaking themselves back $20 more. I mean, $20 less when they buy them in. So yes, we get cattle shipped in. Remember, I said these guys own these cattle. And, you know, in my world, if you put cattle into a pen, someone's going to come out and inspect you, right? So if we have less than 1,000 head in the state of Kansas, KDHD inspects us. If we have more than 1,000 head, then it's EPA. So that's a big break. That's a big cost to those guys that own everything else. So, but 1,000 head based on an animal unit, and an animal unit is 700 pounds. So I can put a whole lot more 5/6 weights in than I can put 8 weights in, or hold them in that confinement. You know, world's changed. We finished to 1,350 pounds. So that means that my backgrounders can take them up to 950 to 1,000 pounds when the cycle's right. This comes from Noble Foundation. 2012 cattle cycle book was looking at prices. And if you look at the last half of the year, there's a pretty good pricing in there for 950 pounders steers coming to market. And by God, when the backgrounding money makes it, we're going to send them there. So that's kind of our market. That's kind of our model. I guess I get a little nervous standing up here. Sourcing is a big issue for us. Again, this comes from last week. These were just receipts of the auction, direct. You know, direct market and video internet sourcing takes all the good cattle out, and the sale barns we get all the crappy stuff, right? If you want to look at that, this right here, do you know what that means? I'm on the edge of the Flint Hills. We have double crop for summer. When cattle come on to grass about May 1st, if we double stock, we can put twice as many head on from May 1st to July 15th or so, and get better gains that way, and then pull them off and send them. So that's a lot of that right there is a lot of those double stock cattle coming off the grass right now. So that's what the difference in that little scenario is. Price is just a huge issue this year, and sourcing and finding calves has been hard this year. You know, a lot of my guys will try to buy cattle February for grass season. Why do they get their cattle bought in January, February? Because March prices start to go phenomenal. In fact, in my area, there's a lot of people switch over to fall calving. 1, because they don't get those little icicle pop calves in February. And 2, the pricing in March and April is phenomenal. And so if you're going to buy calves and you want to make money, you're going to buy them before then. So usually, June market drops. Most of that cattle inventory is flowing through. Everyone's focusing on farming. And so typically people don't want to be in the market. But this year we were all in the market. There's a whole lot less cattle. And you couldn't buy a June calf for less than an April calf price. That pricing scheme this year is just phenomenal. And because of that, cattle numbers are tight. You know, we're at the lowest level we've ever been. A lot of people going in demand. So what does that mean? That probably also means that we are picking up new sources of cattle. New sources of cattle meaning we're probably using buyers we haven't used before. And what are those buyers doing? Well, they probably failed for someone else. So they're up looking for someone. By God, I got to buy cattle. I'm going to buy from this guy, right? So the question on BVD testing. You know, it's a tool we've had now for a few years. My clinic, we put up a BVD lab in-house now in January. So we've been running it about 6 months. We're not advertising it. We're trying to do it mainly for our own clients. And then we've done a little bit of contract stuff. A lot of people talk about, does it make sense to test? Does it make sense? Is it cost effective for BVD testing? Well, if I've got a new buyer, this has been my motto, 2,000 head per buyer. Not all those guys like to hear that, but in my area, it's about $3.15 to run that test. So I'm looking at 2,000 head on those costs there. Studies have said 3 head per 1,000 is about what you expect. So I picked 2,000 head. Why do you pick 2,000 head? Well, if the guy's not buying a lot of cattle through this buyer, maybe he's buying 100 head a month. That puts us through about a 1.5 to a 2-year cycle. Sometimes they're buying 300, 400 head per month. That's a pretty quick swing through. But if they're not buying it that fast, that means that gets us through the ups and the downs and the tight parts of the cycle and the loose parts of the cycle. And, there's this thing, too, that the buyer will buy you a really good load at first, not too bad load second, and about the 4th or 5th load, they just buy the crap, right? So by doing this, I can kind of get by and figure out what that buyer's doing for that client. So that's been kind of my motto. If I figured that just the cost of a PI in a pen increases my morbidity by 15%, for 2,000 head, that's the extra cost on the morbidity. This is just, guessing numbers. And if I say per PI, I'm going to increase my mortality by 1%. In that 2,000 head, that's my increase in cost. If I take those two together, subtract out that 6,300, and I've reduced those values down, I would say that probably works. So I can probably afford to do it. And if we're buying 6 or 8 head of PIs from this guy, we either need to figure out how to change costs, figure out how to change buyers. Something's going to have to happen. But you ever notice one other thing, too? You don't get a PI calf per pen of 100. You'll go settling along, and then pretty soon you get 2 or 3 all in the same pen. That's because that buyer figured out he's buying from this one guy that drops them all off that no one else is paying for him, so he can buy them back, $40 cheaper or something? So once I remove my PI, if I take my PI out of the pen at the beginning of the processing feeding, at the beginning of the startup or feeding period, then that eliminates one issue that I have to deal with. So now what are my other issues? And I guess Texas doesn't grow BRSV, but Kansas does. We get it late summer, early fall in our summer calves and our baby calves. And then in our feeder calves, 4 or 5 weights, we'll probably get it in October, November. We've had times where it showed up on one farm. And then about 2 miles later and about 3 weeks later, it shows up on the next. And if they get it, it's devastating because it is hard to get them stopped. Vaccinations don't shut it off very well. So yeah, we BRSV vaccinate with everything just because it's there. Pre-existing conditions, those are the guys that, someone else started those calves at 350 pounds, took them to the sale when they're 500 pounds, they've already been sick. They're going to get sick again. Or the order buyer is supposed to put them together within 1 or 2 days before they ship them. What do? They put them together 5 days before they ship them, so they're already sick when they get there. So those are usually the ones that peel out in the first week or week and a half, we hope. Environmental is a big issue, especially this last year. I'll talk a little bit more about that in a little bit. Coronavirus, for us, it's been an interesting learning process on that. This custom yard is started taking on a client. Basically, they're a starter yard now for a fairly big corporate yard. They got them because a couple other starter yards were having a hard time starting these calves. Alabama, Mississippi, 600-pound, 500-pound, 600-pound steer calves. We got 305 head in. 1 tested positive as a PI. And we've been doing a little bit of this over the last couple of years and just trying to learn what the value of it is. So they went ahead and nasal swabbed 5 head out of this pen, out of the set of 300. And you see something really consistently repetitive all the way across. These guys must have came in with coronavirus. Now, we haven't done any kind of vaccinations for coronavirus. If your CT score is low, that means you've got a lot higher chance of it being there, and we're between like 18 to 22, except for 1. We really don't see much else. You notice that there's no mycoplasma here. I know Dee's been working on some studies. I know someone else that comes in and does some sampling. They find that a lot of times it's 3 to 5% of those calves coming in have mycoplasma. By the time you hit 7 to 10 days, you're going to find it in that pen, 30, 40, 50, 60%. But you notice on this group, we didn't get mycoplasma on this particular set coming in. And we don't have really a lot as far as bacteria-wise. Vicki Cooper's going to talk Saturday morning about predictive value of all that. Like I said, the big thing for us is this corona. We've had times in some of our yards where they've broke 20 to 30 days, and we'll nasal swab and we'll find them breaking with corona. And usually what you see is about 5 to 6 days of a high fever, sickness, not much mortality. And they kind of just roll through it. It's environmentally stable. So we had one place where we were finding it. It was May, right behind the bunk. It was nice and wet. And I suppose that ground right there was just holding it. And so they were reinfecting different calves through there. So we have to deal with that issue. Horse purchasing at the wrong time. This winter has been miserably cold. We had a cold snap in December. We had a lot of bad snow effects the first part of December. And eastern part of the United States was warm and pretty wet. And it was affecting a lot of travel. What happened with that is the order buyer couldn't get the cattle there until about the 23rd of December. So he cleaned out all of his, everyone cleaned out all their pens, all their sick calves. And so those were a couple of nasal swabs that I took out of one pen. And basically everything was on there, I think. So yeah, he tried. And these were sick calves. These then came, we had a cold snap in January, right the 1st of January. And the guy was buying Virginia calves. Like I said, he got the trader calves, because usually he gets really nice calves from this guy. And he was having a heck of a time. We did the PCR testing on sick calves, and this is what we found. We've been doing a little bit of some trace mineral testing. Missouri cattle, it's been kind of interesting, because the two things I see an issue in Missouri cattle are manganese deficiencies and cobalt deficiencies. And I didn't know if cobalt was real, because one of the labs said, well, they mainly test that for feed. But these were some more Missouri calves, came in June, late June last year, hot, humid, crashed right away. There's a hypertrophic cardiomyopathy calf. When I did his liver sample, cobalt, manganese. I've been getting a bit of that coming out of those Missouri calves, and it's repeatable. Like, did some Arkansas calves, Texas, you see the selenium, zinc, copper type stuff. But for whatever reason, I've had a few different times where coming out of Missouri, it's manganese and cobalt. What does that mean? What do I need to do? What do we need to change to make that better? How's that affect the immune system? So, couldn't save that guy.
All right, thanks, Dr. Laurin, very much. There's just too much good stuff, Dr. Laurin. All right, our next speaker is Dr. Jan Gawthrop. Dr. Gawthrop is a practicing veterinarian from North Manchester, Indiana. He is a 1975 graduate of Purdue University. Go Boilers. His practice, calf care, focuses on young dairy calves that eventually develop into Holstein feeder steers or dairy replacement heifers. His interaction with clients involves all aspects of calf disease prevention, including nutrition, immunization, housing, and daily husbandry practices. Gawthrop and his staff conduct contract research work for most of the large pharmaceutical companies and conduct numerous in-house studies analyzing the benefits or lack of benefits to methods and procedures commonly practiced by his clients. So let's welcome Dr. Gawthrop.
The noted philosopher Groucho Marx said one time, "I have no respect for an organization that would have me as a member." And due to the fact that I'm speaking here today, I have some concern about the authenticity of this meeting. But perhaps I, like Dr. Guterbach, am a token. You all today have heard probably way more talk about black and whites than you ever wanted to hear. The first Academy meeting I attended was in 1995. It was a special meeting on feeding Holsteins. And I remember one speaker getting up, dutifully adorned in his big belt buckle and boots, and he said something about, well, yeah, a lot of our lots are feeding them damn things, and, well, I don't know, they feed just about like real cattle. And so probably what I'm going to speak about isn't anything real, but we're going to talk about Holstein calves. We've heard all day everybody talking about lightweight, high-risk, long-haul feeder cattle. You big sissies. That is a lightweight, long-haul, high-stressed, no immunity. And that boy and 150 others from 150 other dairy farms is going to come to my client's barn 3 days after that guy is born. We don't know if he got colostrum. We don't know when the last time he was fed. We know that he kind of looks like a Holstein, and we're sure that he's a bull. We do see some dairy heifers come into our practice, a lot less now than in the days when the dairy business was robust, and we're starting to see the heifers come again, but Dr. Corbett, I'm sure, is going to talk a lot more about that and more astutely than I can. But we'll talk about the Holstein steer calves that come to us. As I said, we know very little about him. He'll get housed in one of two different management situations. This is the more typical operation that we will see. This operation will hold anywhere from 150 to 200 head of baby calves. They'll come at one time. It'll be managed as an all-in, all-out facility as a means of controlling diseases. I'll show you some graphs later so that you'll think I'm astute. But I'll show you some graphs later showing our disease curves and so forth. And I don't have a morbidity-mortality curve over the years, but I think accurately state that we see less mortality now than we did 10 or 15 years ago. And it comes about because our issues with baby calf diarrheas now is much less. We're managing it better. We still see the cases of diarrhea, but we don't lose calves from it. And we usually don't panic when we see it. This system allows for some mistakes to be made. There was a question on biosecurity earlier today, and we actually hope that calf is going to infect that calf, and he's going to infect that one, and this one's going to infect that one. And as a result, we have a homogeneous group. We have a group where we know that they are exposed to everything within that group. And when that population moves, the chance of them having to deal with some of the commingling stresses that are common will become less. We also have some producers who raise in this type of a setup. Not as many. This is definitely the minority in my part of the world among my clients. This is a dairy heifer operation. There are some Holstein bulls raised in this kind of a setting. In this setting, there is, those of you who are experienced with hutches will probably say they are too close together, and they are. And they do have cross-exposure from one calf to another. And one of the beauties of raising in hutches is that you can maintain a distinct bio unit, that there is no cross-exposure back and forth. And I have some clients that do that. And when we get into this type of situation, post-weaning problems in this kind of a setup is much greater than the diseases in the other setup I showed you, simply because what we're doing is pre-exposing the calves raised in the building. There's issues with ventilation. There's issues with sanitation in both of these. Each of these type of structures can get too hot, too cold, too crowded, too wet. There are ways for the human to mess it up no matter what kind of setting there is. Areas that we can influence. I think it's safe to say, and maybe this is the best place to say it, that the most dangerous organism that we deal with is man. And when we control man, have they done any genomics on humans to identify the genes which make them better calf raisers and better husbandry people? We'd like to see the markers. And, along that same line, my son's wife is a kindergarten teacher, and my son has come to the conclusion, he's made this observation, that stupid people have stupid children, and they have a lot of them. And maybe that's true of people who raise calves, because you got to be a little crazy to want to have 250 bawling babies arrive at your place on a pot one night, and away you go. But we deal with a lot of things, and I try to simplify things so that my producers are thinking about two things, or at least I and my staff are thinking about two things, and that is we want to either do things to decrease exposure to organisms or do the things that are necessary to increase resistance. In the Holstein bull business, we have very little exposure to this kind of stuff. from here on up. We have very little exposure. Our calves come to us, they're dirty. They're infected. Somewhere between 10 and 30%, depending on what measure you use, will be colostrum deprived to some degree or another. We run about an 8 to 12% incidence of naval infection. It's coming. We know it's there. We're going to deal with it. Those things we can deal with. We don't whine and cry if we have a calf that comes in with a serum total protein of 4, which means he's had no exposure to colostrum. We can gripe about it, but we have no control over the source, and that calf is ours, and we're going to raise him. And we've gone through the studies, and yes, there is an advantage to calves getting colostrum. And those who talked earlier about taking care of the dam so that the calf is in much better shape, kudos. That's very, very, very important. In my world, I got no control over that. Likewise, we have no control over these things. But the other things we do, we can give that calf a clean environment. We can control the commingling in such a way that we're in control of it. We practice good management as far as all in, all out. We can sanitize between groups. If we have a break with something, disease-wise, the next group doesn't necessarily have to have that same thing. Yes, we use antibiotics, and we use way too many of them. But along that line, I have recently had several consultations with an organization that is wanting to raise antibiotic-free calves. And to those of you in the beef business, that probably maybe could be done. He wants to do it in Holsteins. And I'm up to the challenge. I got my ideas, and I think we can do it. And I usually ask my clients when we're in the middle of an outbreak of something, I say, how are we going to fix this? How would you fix this if there were no vaccines and there were no antibiotics? I'd give them Benamine. Yeah, well, okay, let me rephrase that. There's no vaccines and there are no drugs. How are you going to fix this? And it goes back to them. What is Homo sapien going to do about this? We have control over the nourishment that they take in. And I will back up what Walter has said in the fact that, yeah, we've increased the caloric intake. We haven't made a dramatic reduction in the amount of respiratory disease. We have better effect if we start doing this and we start doing this. We do vaccinate calves. We vaccinate them too much. We vaccinate them in response to the feedlots who ultimately say, by gosh, you got to get this vaccine, this vaccine, this vaccine, this vaccine, this vaccine in them, and a little bit of that. And by the way, maybe 2 doses aren't enough. Could you give them 3 before we get them at 11 weeks of age? No. Or we'll just tell them that they do, and we will try to vaccinate for the sake of the calf, and ultimately the sake of the feedlot as they receive those calves. I think it's very important that my clients understand this and that my staff understands this, that germs do not necessarily equal disease. You can guess that if I were to show you the same pictures that Jessica just showed you on cultures, we always get bovine respiratory syncytial virus. And if it doesn't show up on the lab report, we think maybe the lab didn't really run the test. Same is true for coronavirus. But does that mean that that's a major player in the disease? Maybe not. We oftentimes get mycoplasma. Somebody showed a survey where there was 60% positive isolations of mycoplasma today. Yeah, that's pretty typical. Is that what's making the disease? And if it's there, what are we going to do about it? Because it's going to be there. And the question is, okay, Mr. Manager, what are you going to do about it? What are you going to do to prevent it? What are you going to do to make sure that that problem doesn't get exported to the next level, that next location where that calf's going to live? I try to convince my clients that they should raise calves in such a way that their name and phone number is on the back of the tag. So that if there's questions at the feedlot, those questions can get answered. Our diagnostics are fairly simple. We look at the calves. Observations need to be made slowly. They need to be made quietly. Our calves are not afraid of humans. In fact, humans are the source of their nourishment. So they look forward to seeing the human. In fact, we have to make the observations in the quiet of the day when they're not accustomed to being fed. The observations are to be made slowly, quietly, not intervening. We're not taking temperatures. We're not squeezing tracheas. We're looking at how the calves are resting. We're looking at how they are responding to the appearance of the feeder. We are measuring those things and keeping records very similar to what Dr. McGurk is doing. And generally, if I can convince a producer to keep records once, he sees the benefit and he continues to do so. We do look at the group, and in looking at the group, we want to measure the degree of sickness that we see in a population. This is a real typical pattern. This is days that they're in the pens on milk. This was from a different study, but this is dollars spent on medication per day, not per head. And so there's a big peak right here. That's when they have diarrhea. This little blurb here is when they're breaking with the second go-around of diarrhea, probably from cryptosporidia. Most of this expense is going to be electrolytes, not antibiotics. They'll break with respiratory disease about here, and everything will be rosy until they start the process of weaning. That's not the right curve. And when we see an outbreak like this and see something going on, we go back and say, hey, Mr. Producer, what'd you do wrong? And because of the high incidence of medicine use and disease back here, we're saying, okay, all right, what's going on? And we go back into this guy's place, to Matthew's place, and there was all kinds of issues with too much moisture in the bedding, too low airflow. There was reasons why those calves had high levels of disease. And it wasn't a germ, it was man. And there's one of our finest outputs. Hey, boys, what are you going to give me for? Okay, our problems oftentimes come about after the calves leave the pens and they get weaned. And does this sound familiar? They're being commingled. They're having to deal with socialization. They may have been hauled, albeit just across the driveway on that same farm, but they've been moved. They're having to work for their food for the first time. No longer is there breakfast in bed. They got to find the water tank. They got to find the feed bunk. Does this sound familiar? Of course it is. And it's the same things that we deal with. Even though the calf has never left home, we're dealing with the same issues that a feedlot does in dealing with the stresses that bring about diseases and the means. My job is to figure out how we go about eliminating or spreading out those stresses in such a way that we don't end up with disease. And that's a pretty set of debutantes just ready for the ball. Thank you very much.
Thanks, Dr. Gawthrop. Our last speaker is Dr. Robert Corbett. Dr. Corbett received his DVM from Washington State University. He's currently involved in a dairy production medicine practice centered in Spring City, Utah. They have approximately 60,000 animals in the United States, Mexico, Central America, and South America on a production medicine program. This production medicine practice includes calf management, heifer replacement programs, mastitis prevention and control, milking equipment evaluation, computer analysis of dairy records, reproductive efficiency, and dairy management and nutrition. Dr. Corbett's major areas of interest are dairy replacement heifer programs, with emphasis on management and nutrition to maximize the normal genetic potential for growth, health, and production of dairy heifers, and transition management and nutrition. And so I'm just going to go ahead and let Dr. Corbett get started since it's getting late, and thanks again for coming today. Let's welcome Dr. Corbett.
She didn't say what year I graduated, because ever since I turned 80, it's just really been downhill. I'm going to have a little bit different approach here. Most of my clients are the calves are raised on farm, and most of them are large dairies, but I do have calves, on pasture-based operations also. But I want to look at the different times where I normally see incidents of BRD and heifers. And I want to start out with, these are the different times. I mean, obviously we're going to see BRD at any time in the calf's life, but I see increased incidence in these particular phases. And I want to cover each one of these and kind of give you a reason or why I think we see issues here. 5 to 12 days of age. These calves are calves that had issues at the time of calving in general. So we had calves that are severely stressed. They were born in the middle of the night. It was below zero. The smaller farms don't have 24-hour attendance caretakers for the calves, so they're born out there. They're not taken care of. They probably didn't receive any colostrum until the next morning. These calves really have big issues. Also, I was really glad to hear Dr. Griffin talk about the influence of the mother on the condition of the calf. That's one of my main issues. When I work at the transition cattle, the nutrition of the close-up dry cow is absolutely essential to the health of the calf. And I really don't like these transition diets where they pump 10, 12 pounds of straw into a close-up dry cow. These calves, there's a lot of calves that are born with inadequate body reserves of protein and energy because of poor nutrition to the mother. 72% of all the amino acids that are present in the bloodstream of the mother cross the placenta to the fetus. And the fetus uses that amino acids both as an energy source and a protein source for growth. So if that cow is short of metabolizable protein in the last 3 or 4 weeks prior to calving, there's going to be an issue with that calf. So if we see calves, we need to look at the body condition of these newborn calves. We saw a really nice picture today of a calf that was born in perfect condition. I see calves all the time that are born in about probably a body condition score of about a 2, if we were looking at a cow, because of inadequate nutrition. Failure of passive transfer, I think everybody understands that that's an issue. And if we have that, usually 5 to 12 days of age is where I see issues with BRD in these calves. I have a lot of clients that record the temperature on every single calf every day between 5 and 12 days of age. And if they're in the cool weather, if they're 102.5, they give them a metaphylactic shot of antibiotics. And one shot with a longer acting product. If it's in the summer, usually about 103 they do it. And in most cases, we record the temperatures. They're on each hutch. And in most cases, we see that temperature drop down the very next day. And we have no more problems with those calves. But if we don't treat those calves, they become clinical cases that don't respond well to treatment. So I'm a big believer in temping these calves at least during that time period. It's a lot of work, but we've had really good results in treating those calves early like this. So if we see these kind of calves here that have absolutely no muscle or very little muscle deposition between the hook and the pin, the back of the leg, the ribs are showing, the spine is prominent. Those calves there are 2 days old. There's obviously an issue there with the nutrition of the mother. 3 to 5 weeks of age, I think, is probably the next really common time that we see higher incidence of BRD. And almost always, this is associated with issues with nutrition or nutritional changes, but especially inadequate nutrition. I would venture to say that probably 80% of all the dairies in the U.S. are still on the traditional 2-quart twice-a-day program on feeding their calves, which is borderline starvation. When we get around 3 weeks of age, the calves are on this type of diet, the 2 quarts twice a day. Those calves basically don't have enough energy or protein anymore to fuel their immune systems. And these calves become very susceptible to whatever pathogen happens to be in the environment. So when commonly 3 weeks is a very common time for me to see an increase in BRD, especially if they're on a poor nutritional program. If we're on a milk replacer and happens to be 20/20, the whole milk is 27% protein on a dry matter basis, and we have a product that's 20% protein, and we're giving them about a little less than half of what they should be getting. There's just no way that that's even close to providing what they need. One other thing about this, the milk replacer, is that compared to whole milk, we have a whole milk is probably around 30 to 33% fat, 27% protein. These milk replacers are just horrible unless we can find one that has a higher level of protein in it to be able to supply these calves and supply their immune systems. Also, my biggest pet peeve is for people to say, I wean my calves at 8 weeks of age, or I wean my calves at 7 weeks. You know, some calves are not ready to be weaned then. These calves have got to be weaned based on dry matter intake and rumen development. When the rumen's ready to be weaned and they're consuming enough dry matter, then that's when those calves ought to be weaned, not based on milk consumption. And so it's very common, if they're going to wean at a specific period of time, they start reducing the milk. So the calves increase in milk, then they get it to 3 weeks or 4 weeks or 5 weeks, and then they cut the milk in half to force these calves to increase dry matter consumption so they'll be eating enough grain at the time they wean. What they don't realize is that when they cut that milk back and those calves consume a high level of starch all at once, we create rumen acidosis in these baby calves. And there's plenty of research now to show, they have pictures of these rumens in these young calves. They're just black from acidosis. And so these calves need to be maintained on this milk level until they're consuming enough dry matter to be able to be weaned when their rumen is ready for it. But when they cut that milk back, about 3 days to 5 days later, we see a tremendous increase in issues with respiratory disease in a lot of these calves, especially in the winter, because when they cut the milk back, they no longer have enough nutrition to be able to fuel their immune system and maintain their body temperatures. So as a result, these calves start to actually lose weight, and then they develop respiratory disease. I like to maintain the calf at about 20% of his birth weight in milk. So if we're looking at a Holstein calf, they're probably going to consume around 8 quarts a day of milk, and I maintain them on that amount until they're consuming enough dry matter to where the rumen is developed, and they can eat enough after they're weaned to be able to sustain the requirements they need for growth and maintenance and also their immune systems. It's also common to vaccinate calves between 3 and 5 weeks of age. Very common time. The immune system requires a lot of energy. Whenever we vaccinate a calf, we have an increase in demand of energy in order to supply the immune system and get a response to this vaccination. If these calves are not receiving enough milk and we vaccinate that calf, that is a stress on that calf. Their immune system is trying to utilize energy from the body to respond to the vaccination, and there's not enough energy there to be able to do it. So I have at least a half a dozen large calf operations that I've been to that they always would see an outbreak of respiratory disease 3 to 5 days after they vaccinated. And it was because they were on a poor nutritional plane. So I definitely don't like to vaccinate calves at this age. In fact, most of my clients now for the last, I would say, 7 years, we'll use an intranasal vaccine at calving, and we don't use any other vaccines until probably 4 months of age. And we really haven't had any issues with respiratory disease. The next period that we see a lot of issues is post-weaning. And probably the most common time. And we do not have to have a problem with respiratory disease at this time. Because the majority of the time, the calves are weaned at a specific age. A lot of these calves are not ready to be weaned, and they're taken off. Let's say they're fed on whole milk at 27% protein on a dry matter basis. They go on to a grower ration. A lot of times it's 16% protein. Those calves really need to have a diet from around 20 to 22% protein when they're post-weaning. So they're cut off when they're not ready. They can't consume enough dry matter, and they have a severe ration change. They have a social change. They're taken from hutches and put into small groups. Those calves don't have a chance. So we see this high incidence of BRD there. If we could maintain those calves on a level amount of milk, they're receiving all the nutrition they need as they grow. They'll grow faster, probably 2 to 2.2 pounds a day. Then those calves gradually increase their consumption of grain, and when it's up to a certain level, then those calves are ready to be weaned. We keep them on the grain for a couple of weeks in individual hutches till we know for sure they're consuming enough grain. In my first group pen, I like to keep them on the same grain for a week, and then I will add about 20% good quality forage to that grain and a TMR for these calves. So we never make more than one change at a time. We'll go to the pen, no ration change. They make the social change about a week later, then we'll make the ration change. But we only go down to about a 22% protein diet on these calves from about 3 to 5 months of age. We can't monitor a starter in these calves when they're in group pens. That's why I like to keep the calves on starter after they're weaned for a week or two, so we can monitor starter intakes before we put them into a group pen. Once they're in the group pen, then we no longer have the ability to monitor starter intake, and it's more difficult to see who's eating and who isn't eating when we first get them into these small pens. The first sign of respiratory disease that I think I see is elevated temperature and decreased intake. So when we're checking the temperatures, when I told you we're checking from 5 to 12 days, I notice, and the caretakers notice, that these calves don't even look sick. We'll get up there to the higher temperature, and they're out there, they're eating like crazy and drinking and sucking their bottles down, and they've got 103-degree temperature. If we treat them at that point in time, we never lose a meal on those calves. But if we wait until we see visible signs of illness, we're kind of behind the 8 ball at that point, and they don't respond as well. And post-weaning, we need a high-quality palatable ration. We need to make sure that it's providing adequate energy and protein. The digestibility of the forages in this ration has got to be very high, because they just flat don't have a well enough developed rumen to be able to use the 120 relative value alfalfa hay that's been rained on 4 times before they got it baled up. A big problem that we face in dairy heifers is that they're considered a cost instead of a benefit, oftentimes, not a profit center when they really are. And so they become the garbage disposal for the dairy. They get all the feed that isn't fit for, or they feel is not fit for the lactating cows. Another issue is we often see vaccinations at weaning time. If they do want to vaccinate before these calves are moved into group pens, it should definitely not be done at weaning. It should definitely not be done at the time that they're moved into the weaning or the small group pens. So basically, we don't give any vaccinations at all around the time of weaning. Spring and fall, we see large variations in temperature, and it's a problem that we see every single year. When we have these variations, and how we can handle that, I don't know. We really can't change environmental conditions, but we really have to make sure that the caretakers are really watching these calves closely during the spring and fall to pick up, because we will see an increase in respiratory disease at that time. The incidents, though, that we see, most of the clients that I have, that if they're on a good plane of nutrition, we really don't see a big issue with this. I have one herd milks about 1,500 cows. They lose about 2 to 3 calves a year while they're on milk, and maybe 2 others during the year from pneumonia. But I think it's mainly the higher nutritional plane. The immune system, in my opinion, I'm not an immunologist, but in my opinion, the immune system of cattle is amazing. And if it has the right fuel in energy and proteins to supply the immune system, it's amazing how those animals can handle exposure to a pathogen if their immune system is up to snuff and can take care of it. Age and size variation within pens. It's so common, especially on these larger dairies, when they start getting huge pens of heifers, that these at night, for some reason, these heifers will grow wings, and they fly from one pen into another. And so then we end up with these little heifers in with big ones, or big ones in with little ones, and that really creates a big issue. These heifers should be moved into these pens based on size, not on age. Heifers do not compete well with each other if they're different in size. So I think we really need to focus on grouping these heifers according to their size so they can compete with each other better at the feed bunk and receive the energy and protein they need to fuel their immune systems and continue their growth. Diagnosis and treatment. I think early detection is absolutely essential. Dr. McGurk's system, I think, is an excellent system. Unfortunately, a lot of the people that I have on the dairies I work with, we haven't been able to get them to be that attentive to the calves. I like to check their temperatures, and I can usually get that done for a 7-day period of time. Other than that, we really have an issue with early diagnosis. But I can tell you that if we treat these calves when they very first start getting a temperature before they have clinical signs, we're much more successful. Just a little tidbit of information that I got from Dr. Van Amberg at Cornell. They did a 4-year study, and they found out that calves that were treated one time with antibiotics, even though they responded well, they never repeated with respiratory disease. They gave 1,000 pounds less milk first lactation compared to herd mates that were not treated. So when we see respiratory disease in these calves, it causes a permanent problem with their future production. And for this reason, I think that we need to focus more on prevention if we can. There have been some excellent talks today on being able to try to reduce stress factors on these calves. I think prevention is the goal and not treatment. And that's all I've got. Thank you.
All right. Thanks very much, Dr. Corbett. I hope you appreciated hearing from these practitioners. We were scheduled to have some question and answer. We're kind of over time. I was thinking about inviting them up to take 10 minutes of questions. Anybody want to ask any questions, or everybody really ready for a break? What do you think? Maybe we'll just take questions for anybody got 1 or 2 questions, and we won't have these speakers come up. We'll just kind of take questions if anybody's got 1 or 2 they want to pose.
Do you have a feeling on whether you should be using textured rations for your starter ration versus pelleted?
Yes, I do. I've run at least a dozen trials on my clients, and I have the lowest intake that I have is when the farmer tries to make his own ration. It's all ground up in powder. And then the second would be a pelleted ration, but in general I have about a 12% decrease in dry matter intake with a pelleted ration versus a textured ration.
Do you do any monitoring of mycotoxins in your rations for the starter ration?
Yes, we do monitor mycotoxins. It's a huge problem. For that reason, I never use distiller's grains in any of my calf feeds at all. I only use soybean meal as a protein source and corn. And we do monitor the corn at the plant that's used to make this to make sure it's not full of mycotoxins.
Dr. Gawthrop, you want to add anything about calf starter?
Other than what Bob has said is reproducible in our part of the world too.